Welcome to Startup Health TV. This is a special COVID-19 health innovation update. I'm Logan Plaster, editor-in-chief at Startup Health. I am happy to be here today with David Weingard, CEO of Cecelia Health. David, really happy to have you on the show with me today.
It's great to be here, Logan. Thanks for inviting me.
David, you have done really fantastic work offering virtual care in a variety of ways to folks with diabetes. And I want to get into that platform and kind of the work you're doing with in the midst of COVID-19. But first, just to start more personally, I know you have type 1 diabetes like so many others. And I just wonder, what has it been like in isolation? What have been some of the unique challenges of managing diabetes during COVID-19?
It's a great question. It's definitely harder for a lot of reasons. One, have to make sure I have enough medication from the pharmacy, especially insulin, which I need to live. The ability to connect with my physician or diabetes educator for any questions or support. That's been challenging. There's electronic communication. It'll tie into what we talk about in a little bit. We're actually helping a lot of the large providers as a telemedicine company. But for me specifically, those two, and then also diabetes blood sugar also ranges based on nutrition and exercise, in addition, of course, to the medication. And if I go more than 2 days without exercise, it changes the sugar levels and I need to take a different amount of insulin. So I've been pretty consistent in my exercise every morning, following the same routine, and also making sure that there's enough food here, because obviously I'm not getting my deli sandwich or salad. So there's a lot more planning and organization to take care of myself, make sure I have the medications and do the exercise and have the food that I need to maintain, my health during this time.
Yeah. Well, that's a good way. That's a good segue into talking about the Cecelia Health platform. I know you're working to help thousands and thousands of patients struggling to manage their diabetes. So start by giving us just the baseline of what the platform and the company is, and then we can talk about kind of where you are at this moment in time with the coronavirus.
Our current platform and solution is about helping patients who are overwhelmed, in denial, not realizing why they need to take their medications, what behavioral work they need to do around their food.
Yeah.
I give them the emotional support and education to take care of their diabetes. We have two groups of, you could say, channels or distribution partners for Cecelia. One are pharmaceutical and medical device companies who pay us to improve initiation and persistency to their drug or device. Because it turns out that half the patients with diabetes either don't start the medication or drop off in the first 6 months. Huge, economic and medical problem for people with diabetes. And then the second group are health plans, several Blue Cross clients and regional health plans, and we're launching with a national health plan where we're engaging members to improve their health and lower the costs associated with diabetes, which is quite significant, and improve quality. These health plans also get bonus payments from the government based on improvement to their diabetes. So what's really key for us is we figured out how to optimize the mix of human and digital so that we can scale and help hundreds of thousands of patients at a time and give them a really personalized experience.
How do you do that? Walk me through. What's that scalable solution? What does that entail?
So one of the things we learned early on is, everybody, it's about an experience. People will, in this day and age, no one wants a call center agent, reaching out to them who's reading a script, especially with something very personal around diabetes, which is lifestyle. And to get people to change, they really have to trust the person at the other end of the phone or video. So we always use the same clinical expert. And they are a clinical expert. They're either a nurse, a dietitian, a pharmacist who have advanced accreditation in diabetes. And we also do chronic care. So we are the patient program for a cardiovascular drug, and there we use cardiac nurses as well as weight management experts for an obesity drug. So using a clinical expert in the field and using the same person that's able to build trust and can work with them over a period of time, and engage with them in English, multiple dialects of Spanish and Chinese, understand their socioeconomic status. And so what we'll do is we'll take in the data and we'll segment the population in high, medium, and low touch. Patients that expect to need high touch may not have had an A1C blood glucose test in a while or not have taken the medication. They'll get a lot of more of the human interaction with electronic as well, email, text messaging, online support events. Medium will get a mix of that, and then low, basically people that are on the program taking the medication. Their blood sugars could be better, but we'll give them content and let them know a coach is available to them. And we'll engage over a period of 6 to 12 months, which is our current model. And I'll talk a little bit more about what we're doing in the future, where we'll be managing populations over time. But I think what's most important here is and where we're different than pretty much every other diabetes player is we start with the patients that are most expensive to our clients, which are the ones, the 18% of the people who account for 40% of the cost. These are people not what we call hand raisers. They're not like, hey, I'm going to go test my blood sugar. I'm just going to go get the diabetes medication. They're just overwhelmed. Diabetes is a job no one wants. And for that, they're not going to download an app. So we need the human touch scaled to pull them in, educate them, and then get them on different technology.
You mentioned earlier some of these really startling stats around the lack of therapy adherence, just, not taking your meds, do you have any numbers around how that has changed? Has it gotten worse during COVID-19?
It's interesting you ask. It's definitely gotten worse. We work with our clients. So on the pharmaceutical side, what we hear from them is, people are not able to go to their doctor. So they're not able to get their scripts or get, a health checkup where they get diagnosed and get, prescribed a medication.
Yeah.
So those are more challenging. And people, there's access issues with pharmacies. Obviously, there's economic challenges now with huge unemployment. So it's been worse. And then obviously people can't go to the doctor for the appointment themselves, where they're going to learn and be challenged and motivated. So it is really tough.
Do you know if anyone has done the work to try to quantify some of that sort of, tertiary damage, within the diabetes market due to COVID-19? What's the potential downside?
I haven't seen any studies yet. I'm sure they'll be out, and we'll actually have a lot of data based on how we're engaging with patients now. I will start by saying that the diabetes situation in this country is so much worse than people realize. It's not only that a number that by 2030, 1 to 3 Americans will have diabetes, and this is mostly type 2, which accounts for 95% of diabetes. Type 1 is like me, where my body doesn't create insulin anymore. Type 2 has a lack of regulation of insulin and largely could be brought under control with medication, nutrition, and exercise. But it's not only that, the pervasiveness of diabetes and the cost, which is now estimated over $300 billion a year to the U.S. It's more about, we're learning as we engage with clinics as the telemedicine provider, that even people who are coming in for appointments, these are not targeted populations, people with poorly controlled, their blood sugars are really out of control. And what that means is you don't die from diabetes right away. But what happens is, if your blood sugar remains out of control, if it's out of range, exponentially, there's an increased rate of heart disease, renal failure, neuropathy, loss of feelings on the hands and legs, and general mortality. And so I actually think that number one, there's a real lack of awareness of how poorly people with diabetes manage their diabetes for a variety of reasons that, like we've discussed, and B, that's magnified by the COVID situation.
Yeah. Okay, so let's move to kind of the actions that you're taking now. We've talked about Cecelia Health's scalable platform of dietitians, nutritionists, these certified assistants working with patients. But I know that now you're really moving fully into telehealth as an offering. So talk to me about what that transition's been like, what the challenges have been like, et cetera.
So I'll share with you how we're evolving, and this was pre-COVID, and how it's accelerated due to COVID as well. So we've been innovating for the last 2 years about how to remotely manage a population, integrate the proactive with the reactive data that might come from a continuous glucose device, where you get real-time data on people's blood sugars. People don't have to test their blood sugar. I mean, I used to test my blood sugar with my hands 4,000 times a year. Now I don't have to do it. I just wear a sensor and I get the data to be shared with my clinician who helps me. So we've done a series of pilots sponsored by the Helmsley Charitable Trust and the Jape Center of Research, where we publish results that we were able to get patients anywhere on the country on the CGMs and virtually persistent by the end of 3 months and understand their data. So that's the base. That's the base of the telemedicine equation, is getting people on the devices that we could integrate into our coaching. The second wave is where we're launching in July with one of the largest national payers, who are taking and not only getting them on the devices, we're overlaying decision support algorithms that interpret that data so we could take in large amounts of data at scale, make recommendations to the diabetes educators. And these diabetes educators, if they were in a clinic working for a provider, a physician right in the office, they'd be able to make dosing changes and prescribing medications. So we set up a national licensure so that they could do that, and we can operate as a telemedicine company. So we're already doing the coaching at scale. Now we're integrating the data that's coming from innovative devices, and we're integrating that together to actually manage people. And that's really important, because when you look at the map of the United States, there's only 3,000 endocrinologists for 32 million people with diabetes. And again, another pain point, and that's, I think, going to come to a crescendo in the next few years. And especially, these endos are in the East and West Coast primarily. What are you going to do if you're relying on a provider who wants to refer you to an endocrinologist, but there are only 2 in the whole state? Mm-hmm. And so you're going to, people, they're not going to travel. They don't have the time. They have their life. But imagine that provider referring them to a Cecelia Health virtual clinician care team, and then being able to work with them ongoing from there. So it's value-based for the providers. It's value-based for the payers. Obviously, it's great for the patients as well. And that's what's needed.
Shifting gears slightly, as an entrepreneur, what was it like to put these plans into high gear? How much did you have to speed up your processes? Just a few days ago, I interviewed somebody who had this grand plan for 2021, and when COVID-19 hit, they realized we have to do this today. So what was it like for you to really speed things up and bring this to market?
Yeah, great question. So with the evolving telemedicine, that timing actually has been good tailwinds for us, because that took almost 2 years of planning and Billy, you can't throw a switch and turn that on. But we're ready, and we're going to be live during this COVID situation and be very helpful to it. But the other part that we've been agile and we've launched quickly and being help to diabetes patients is we've launched with several dozen of the largest diabetes clinics in the country. Imagine these name brand clinics who they have patients coming in every day, and suddenly the patients can't come in and the clinicians can't be in. and they're really not set up for telemedicine. So, are they just going to let half the patients not be cared for?
Mm.
So they've been forwarding the patients to us, and so we're basically providing supply to these diabetes clinics and making sure, because they're being measured on improvements of quality, that they don't get fall too far behind.
Yeah.
Because whenever they get measured, they get these quality bonuses based on it. And if they didn't see half the patients because they couldn't fill the appointments, then they're not going to receive that revenue, or they're going to be dinged based on cost. So what we have been agile and what we have been able to do in COVID is be a rapid response supply telemedicine company. And we're getting real-time data and insights on the ground every day.
Yeah. So it sounds like you're really trying to attack both sides of that equation in terms of the patient care and also the revenue coming in, because we don't want to see these clinics all going out of business over the next couple of months.
Absolutely.
Do you feel, what I hear you saying, do you feel like it's safe to say that patients with diabetes could be a population in healthcare that could kind of fall in the cracks between emergency services and what we deem as non-essential elective healthcare? People who have sort of day-to-day emergencies, but might not have the infrastructure to get that care because maybe the system doesn't see them as the emergency that they are.
Absolutely. Before COVID, diabetes in this country was in a crisis state, and parts of the patient and provider medical system recognizing we're starting to act on it. But right now, obviously, we have to prioritize COVID, and it's hard enough to engage someone with diabetes to do the right things,
Yeah.
for them to understand what to do, to take their meds. And we talked a little bit about some of the challenges. Now they're magnified.
Yeah.
So people are dying from diabetes, as I said, largely through heart attacks and increased, cardiovascular issues and other parts. But the reality is this, we're going to pay for this, months from now, because people are not able to get the care that they need for their diabetes now. And the momentum is also lost.
Yeah.
And so I think there's going to be a huge catch up, and we need to be prepared. Providers are already overwhelmed too. And they're going to need, companies like us that provide the expert virtual support to help them manage their patient population.
Yeah. To wrap us up here, how do you see COVID-19 really changing Cecelia Health in the future? If you were to look out 6 months, even a year, how do you see the market shifting in really substantive ways and your company's offering evolving because of the pandemic?
Yeah, the good news is that we were already set up as a virtual organization, delivering virtual services through, phone, video, email, text, and capturing the data in a HIPAA compliance system. So, in effect, we were really ready for COVID. What I see the impact is that we're seeing the tailwinds already from the clinics we just talked about, for the payers who need help, and then how we're evolving as a telemedicine company. I actually see that we'll be able to provide more value to the health plans and the providers and patients because of our infrastructure, and it will help to do good in the world with more impact and in greater scale.
Yeah.
And certainly the flexibility and telemedicine codes and billing that the government has rolled out has been very helpful, and will be helpful for us in years to come.
Well, I think that's a good note to end on. David, thank you for the work that you're doing with Cecelia Health. It's such an important patient population, and I just wish you all the best and good health.
Thank you.
All
Be
right,
well.
keep it up. Take care.